In physiologic splitting, the split S2 can be a normal finding in the appropriate clinical setting. What you'll typically hear is a slight delay in the closure of the aortic and pulmonic valves, which results in the splitting of S2. The splitting of S2 is exaggerated during inspiration because of two reasons. The first is that when you breathe in, there is an expansion of the intrathoracic cavity, resulting in a decrease in intrathoracic pressure. The second reason for why we hear S2 splitting during inspiration is that the capacity of pulmonary circulation increases when we take a breath in.